We're not going to do any treatment. I think this will just get better on its own after a period of time. Newsflash, it does not get better.
No, it gets worse.
It gets worse. It gets so much worse because
Yeah.
now you've taken your child out of any social interaction, any structure.
Hi, I'm Lydia Thompson, and I am a mental health counselor and the host of Counselor Off the Clock. My aim is to make mental health conversations more accessible and to keep you company while you grow. This episode, we have Jessica Lavender from Embrace You. In the first part of this episode, we talk about the levels of mental health treatment. We also get into the Netflix documentary, The Program, which is about the troubled teen industry. Our topic for discussion is symptom accommodation, which is basically enabling, and why this actually makes symptoms worse. If you are loving this podcast, subscribe, rate, and review us. You can find us on Instagram and TikTok at Counselor Off the Clock. I hope you can get comfortable because we are off the clock.
Thank you so much for being here, Jessica. I really appreciate it. Now, for all the people out there listening, can you tell us a little bit about yourself and your role in Embrace You?
Sure. Well, thank you for having me. This is a new experience for me. So excited to give podcasting a try. So my name is Jessica Lavender. I am a licensed professional counselor by trade. I went to Lipscomb for my master's and graduated from there in 2009, and I've been licensed since 2011. So I've been doing this for a while. I currently work for a child and adolescent treatment program in Brentwood called Embrace You. My title is the administrator, which means pretty much everything when you are a new business. You know, we're just barely out of our first year, so basically
You do everything.
a little bit of everything, from clinical guidance to billing to ordering supplies to changing light bulbs. That is me.
Oh my gosh.
Yeah.
You do everything to make it work.
Yes.
Yeah, I'm so thankful for our administrator. Like, I don't think we would be able to get through without somebody doing all the administrative duties.
It's an important role.
Yeah.
There's a whole lot of behind the scenes stuff to make these kind of businesses work, right? I'm sure you know a little about that too.
Oh, yeah. What drew you to working with child and adolescents?
That is a very good question. So I tend to say that adolescents chose me. When I graduated with my master's in 2009, the first position that I took was in an IOP, and it was with adolescents. And the folks that I worked with at that time were not keen on working with adolescents. So they were like, you're the new girl on the block and the new grad, and this is where you're going.
And you get the leftover teenagers that are difficult to work with.
Right. And those teenagers, I will say, they were really hard. They
Yeah.
were primarily court ordered to treatment, didn't want to be there. And it was a really hard job, but I really enjoyed them. I found that I was okay with, being the adolescent person because I really liked it and didn't want to be moved. And so I ended up staying with that population for the majority of the time I was in that position. And as I've gone through my career, that's just kind of continued to happen, where I have had times where I've worked with adults as well, but the doors that have opened for me have tended to be in the child and adolescent space. And I think that that's my purpose in a way. And I also really, I really love the ability to intervene at the age that they are. I think that there's so much life left to live, and if we can intervene early, we can see such a change in how these kids can learn skills and build their self-confidence and really build skills to have better relationships in the future. So many things that I see change before my eyes with kids, and I enjoy that.
I really connect with you on that because I really believe that intervening in those early years can set the trajectory for the rest of their life. So we met in a professional capacity, but we work very well together because we work in very different spaces. So actually, I would love for you to talk about the difference between what I do and what y'all do at Embrace You.
All right. Well, I love this topic. So if I get, like too far and too deep into it, let me know. But this is one of my favorite topics to talk about because I am really passionate about the levels of care that we provide at Embrace You, which is called partial hospitalization and intensive outpatient. But there is a time and place and purpose for every level of care in behavioral health. And I really love to educate the community and patients and families on when to get each level of care. Like, how do we know and what's the right time for each level of care? So I love to talk about this topic. So let's see. I guess to start, the best way to frame this is to think about the levels of care in behavioral health as a hierarchy. And, we can start at the top of the pyramid, so to speak. So the highest, most intensive level of care that we provide in our field is inpatient, acute inpatient care, right? So those levels of care are behind locked doors. You have a lot of restrictions when you're in those levels of care, like things that you can have access to for safety reasons, being able to see your family. It is a very restrictive level of care. And it's really needed sometimes because sometimes that's the only place where people can be safe.
Yeah, I have a lot of people who fear that level of care. So can you tell me, like, who would fit best in that level of care?
Yeah, and I worked in this level of care for a long time, so I understand it. And I understand when it's needed and when it's not. My blanket statement on when people need inpatient care is when they can't be safe anywhere else. So if you're a parent and you are able to keep your kid safe. So maybe your kid does have safety concerns. Maybe they have self-harm or they have suicidal ideation. But if you're able to safety-proof your home and provide a level of supervision to keep them safe while they're having those symptoms, they may not necessarily need inpatient. But as a parent, if you think, despite my best efforts, I am not sure I can keep my kids safe. I am not sure I can protect their life and their safety. That is when you need inpatient care. Typically that is, and this applies to adults and adolescents. My world is just kids. So typically what we see, the symptoms that would require inpatient care are the safety concerns, suicidal thoughts, homicidal thoughts, self-harm that could cause a severe injury. We also see things like psychosis, where people are not oriented to reality and could pose a danger to self or others for that reason. Those are typically the things we see in inpatient. Sometimes symptoms of anxiety or PTSD or panic attacks can get so severe that a person need access to things that you can only have in a hospital, like immediate medication to help them in that moment of distress.
Yeah.
That is something that you really need to be in a hospital to get.
Yeah.
So those are the times that you need inpatient. And just because you have those symptoms, even on a moderate level, doesn't mean that you have to be in the hospital.
Yeah. That's a lot of times like what my clients are concerned about is like, I had a suicidal thought. Are you going to send me to this locked away place? Am I going to be locked away? And that's most of the time not the case, but it does happen where we have to make the hard decision that we can't keep them safe anywhere else.
Yeah, and I have those conversations a lot too, and I really try to reassure our patients that our first goal when somebody tells us they're having thoughts like this is to try to figure out how to keep them safe in their home and in the community, especially kids for whom it can be really traumatic to leave home and be in a hospital setting like that. So we really take the approach that we want our patients to feel safe talking to us about it and feel confident that our first line of defense is going to be safety planning.
So talk about Embrace You and the levels of care that you guys provide.
Sure. So Embrace You provides partial hospitalization and intensive outpatient treatment, which is a mouthful, I understand.
PHP and IOP in our world. That's what we refer to it as.
Correct. All the letters. So what that means is we are a level of care that's in between inpatient and outpatient, what you do, right? So we see kids multiple days a week. We can do a lot of the things that you might get in an inpatient setting, not all of them, and I'll go over that. But we can see kids in PHP 5 days a week, 6 hours a day. We can do intensive medication management in that setting. We do family therapy, individual therapy, parent education group therapy, lots of crisis intervention and safety planning. PHP is for kids who are not able to function in their regular daily life. Kids and adults. I'm sorry if I refer to kids a lot, but there are plenty of PHPs out there for adults too. So this is for people who have symptoms that are so severe that they cannot attend school or work or whatever their regular life looks like, but they don't necessarily need to be in a hospital. They don't need to be somewhere 24/7 to be safe, but they can't function either. So we can help them without them having to stay away from home overnight. The things that we cannot do in PHP are those PRN medications. So like if you're in a hospital and you become so unsafe or distressed that you need like an immediate shot of medication, we can't do that. We don't do any physical intervention. So like for our world, kids who are so aggressive that they may be a threat or a safety risk to other people, we can't do that in our setting. Or like isolation. But other than that, we can do a lot of those treatment modalities in our setting without you having to stay away from home.
Yeah, there's a lot of in between. So I would be considered outpatient. I see people usually once a week. And sometimes they do have similar symptoms. So they might have suicidality, they might have anxiety, depression, but the severity is what determines where you are best treated.
Right. And I want to talk about IOP too, because we do offer both levels of care in one program. So when I say PHP, that is partial hospitalization, the most intensive level of care you can get outside of a hospital or a residential facility. We also offer IOP, which is 3 days a week, and it's after school hours. So the difference between IOP and PHP is kind of nuanced, and usually that's part of our evaluation because we need to really assess you and understand before we recommend one level of care or the other. But one of the big deciding factors for me is with kids, are you still going to school? If you're still going to school and you're able to go to school, we're probably going to have you do IOP 3 days a week so that you can stay in school and come to us for more than once a week support. But not have to leave your regular activities if you're still in them. So that's a big factor. And then safety too. If we're concerned, okay, you're still going to school, but we're not quite sure you're safe there. We're not quite sure that you have the level of supervision at school that you really need to be safe. We might recommend PHP over IOP. So that's a big question. And for adults, it's usually work. Do I need to put you on FMLA so you can stop working while you get this treatment? Then you need PHP. If you want to keep going to work during the day and come here after work, then you're probably looking at IOP.
If people have a concern about their level of safety and functioning, how could they get assessed to know where to go? Do I need to see a therapist? Do I need to do intensive outpatient, partial hospitalization, or do I need to be hospitalized?
Great question. Also kind of a complicated answer.
Totally.
So I think if a person is needing help with depression, anxiety, life stressor type issues, and we're not talking about safety issues, right? We're talking about like, I need somebody to talk to and guide me and support me through this. They can call outpatient, like what you do here at Concord. If a parent calls us and says, I'm just not sure my kid is safe right now, we are going to tell you to either call 988 if we think that is safe for you, and 988 can go through a suicide risk assessment with you right then. And if we don't think you even need to be in the community right now, we're going to say go to an emergency room. So we're going to do a little bit of triage like that just over the phone and make sure that if we're scheduling you to come in and see us in 3 days, that we think you're safe to wait those 3 days to come in and see us. I think 988 has been an amazing resource. We use it a lot, and they
Yeah.
can guide you pretty well over the phone.
Yeah. What a great resource for the general public that if they have any concerns about their mental health, we can call the mental health crisis line without having to call 911. They can call 988. And these are trained professionals to walk through suicidal assessments and can help guide you to make those decisions. Do you need to call a therapist on Monday or do you need to go to the emergency room right now?
Right.
Yeah. What an amazing resource.
I love that it's one number and it's, just 3 digits, just like 911. Call 988. They will help you. And I love that.
Yeah. So if people do have a concern about their child, they can give you a call.
We have a person who answers the phone. Her title is Office and Patient Coordinator, also
Great.
a long title, but she's very trained and has specific questions she's going to ask before she schedules you an appointment with us. Again, because we just want to make sure that by the time someone calls us, usually there's some level of crisis, right? Our full assessment is in person. So, yeah, we do more of a triage over the phone.
Got
and
it.
then we do see, we call them patients, more of a medical model, but we do an in-person intake appointment. Just last time we checked, about 90% of the people we treat do have some sort of suicidal ideation or self-harm reported. So that's the folks who see us. Another difference is that PHP and IOP operate more like a hospital than a clinic. And what I mean by that is we do rolling admissions. When one spot opens up, that gets filled, just like a bed in a hospital. Like I think about the spots in our program like beds. And it is a team approach. You have a treatment team. You do have an assigned therapist. You also have a nurse practitioner. You also have an education support person. So when you come to our setting, it is a program model. And just like if you were in the hospital.
What does a program model
program
mean?
model. Okay. Program model means that, trying to think of the best way to define that because I'm translating what is in my brain to people who aren't in this world.
Yeah.
So it means you have multiple modalities of treatment in one setting. So that means you have an assigned therapist who does individual and family therapy with you. You have other therapists on the team who lead group therapy with you. You have a education coordinator who can support with education if that's something that you need. You have a nurse practitioner who prescribes medicine. We have a nurse, an RN, who checks in every day and does a nursing assessment because we're typically doing some medication management, right? So we're looking for things like any side effects that come up or just, making sure that medications are closely monitored because we are doing that and we're doing that with kids. So it is a model that incorporates multiple modalities of treatment in one setting.
And can people use insurance and embrace you?
Yes, we do take commercial insurances. Yes, we can't take any government insurances, but we can take the commercials.
That is so helpful as well to make sure that people are not paying out of pocket for these services that they really need, because we know that can be a barrier to receiving mental health treatment.
It sure can be. And there's lots of reasons for that.
I'm really thankful to have you guys as a resource and as a partner in Williamson County to work together to serve the populations that we serve.
Likewise.
Likewise, yay. So before we get into our topic, I just watched this documentary called The Program, and I am in the troubled teen industry kind of, right? That's who I see would be teenagers who would be considered troubled or difficult. And I'm wondering if you have any thoughts on the troubled teen industry and maybe the Netflix documentary you saw.
Yes, I do. I have lots of thoughts on this topic. I'm going to drink some water before I start down this path.
Listen, hydrate before we tear it apart.
So I too am part of, the troubled teen industry, and stories like what is told in the program are really heartbreaking to me. We didn't talk about residential levels of care when we were talking about the different levels of care. Residential is actually a different level of care than inpatient. It is a level of care where you're away from home, but for longer periods of time. And this is typically for kids who have been in and out of hospitals multiple times. Parents have not been able to keep them safe. So then we start looking for something like we couldn't keep them safe at PHP level of care, so we have to get in like a longer term 24/7 care. And that's terrifying as a parent because your kids are going somewhere without you for a long period of time. And a lot of times it's in a different state where you can't just pop in and visit your kids. So I understand that is a really terrifying thing for parents. Regarding the program, the documentary, I learned that this documentary existed from a hairdresser, actually.
Wow.
My hairdresser knows what I do for a living.
Yeah.
And the last time that I saw her mentioned to me that the place where she went to high school was going to be on a documentary, and encouraged me to watch it, and I can perceive distress pretty well, and just wanted me to watch it and wanted the message to get out there about this documentary.
Wow.
And she told me about it. She wasn't at the school that was featured in that documentary, but it's referenced in the documentary. She was at another one of the schools owned by those people that was in Mexico.
Wow.
And just the things that she's experienced are absolutely heartbreaking. And so I promised her that I would watch it, and I did. I watched it all in like 3 days.
Same.
She texted me literally the day after I got done watching it and said, I want to make sure that you watch that. I want to make sure that you never send any kids to that program. Wow. And I said, I never have, and I assure you I never will. So that's how I learned about the documentary.
Wow. Yeah, the concern is that there are residential programs still out there that exists, and it is needed. And it seems like this specific program and group of residential homes is very toxic and abusive, and that can happen out there. I mean, that exists.
I know.
It's so heartbreaking, and especially with quote unquote troubled teens, there's a lot that can happen to keep them safe or get them better.
Yeah, and it is very hard even for professionals sometimes to assess what are the good places.
Yeah.
And what aren't.
Yeah, these programs are so needed, and we have to be careful about where we send our kids, especially when parental supervision is not going to exist. And I think it's the same with trusting your child, I think to a lesser extent, trusting your child to a therapist, trusting your child to, an outpatient or an inpatient program. Like, you are trusting your kid to someone who's going to have influence over them. And so from your work with teenagers, what works and what does not work in treating teenagers?
Okay. That's a big question. So you asked what works and what does not work. So I think the first thing we need to look at is evidence-based practice. Research. When I watched that movie, The Program, I don't know that there was any evidence-based practice happening there. None.
No. Oh my gosh, no.
There were no professionals. There were no licensed professionals on that team. They were business people running this program. So that would be a big red flag to me. We should be looking at what curriculum is being used, what type of therapy, what is the program model. There's an accrediting body of behavioral health facilities like ours. We have this accreditation. The Joint Commission is usually the one that you see, and they go in and do extremely thorough audits. They have a lot of regulations we have to follow, particularly around how behavior is incentivized and punishment. I can't even tell you, hundreds of regulations just from the Joint Commission about what we can and can't do.
There are facilities that are going to be under scrutiny, and this was not one of them. This was not one of them. And took advantage of families and communities that were vulnerable. And we understand that when we're getting calls from parents are in a vulnerable state, not knowing what to do with their kid. What we focus on is the connection that we have with those teenagers. We know from attachment work that them feeling safe is actually, that leads them to growth. And so this is the main thing I saw. I was like, they don't feel safe. They're never going to get better. They are going to get compliant. And that's what ultimately a lot of them did. They shut off the part of their brain that they needed to in order to survive. And that is traumatic for people, let alone teenagers in some of the most formative years of their life, not being safe. It's truly sickening. And I hope that I can be, and Concord Family and Embrace You can be a place that kids can feel safe and parents can trust their children with us for positive outcomes using evidence-based practice. It seems like a no duh, but apparently that is still happening out in the world. And so I'm really thankful for this documentary in order to bring some awareness and so that there is some scrutiny on our field, especially when it comes to their children. Oh, wow. I really want to get into our topic for the day, which is symptom accommodation. Can you tell us what symptom accommodation is?
Yes. Okay. And again, I'm going to talk about this from the perspective of kids and parents because that is my world. But this applies really to anybody who has a loved one who is experiencing a symptom of mental illness that is interfering with their life in a severe way. So as the loved one, as the support person, symptom accommodation means that we are intervening in a way that actually perpetuates the symptom instead of supports that person to overcome that symptom. So I guess another way to say it is enabling. So are we intending to support our loved one and really having the best intentions, but doing so in a way that allows this symptom to just probably get worse instead of better?
Can you give an example of enabling or symptom accommodation?
Yeah, so in our world, a very frequent example of this is related to kids with school anxiety and school refusal. We see a lot of kids these days who are extremely anxious about school and have chronic absenteeism because of that anxiety. In fact, I mentioned this to you as I came in today, but there was an article that came out in the New York Times this week that says that since the pandemic, the number of public school students experiencing chronic absenteeism has increased from 13% pre-pandemic to 25%.
Wow.
In the 2022-2023 school year.
Wow.
25% of public school students have chronic absenteeism, which is staggering to me. But we see this a lot in our world. Kids just literally cannot get themselves to school. And it's in our world, it's usually due to depression and anxiety. And an example of symptom accommodation that we see a lot now is parents taking away the stressor of school.
Wow.
Because there are options. There are options that didn't exist as frequently pre-pandemic that are there now, like an online school option, right? So a lot of parents see their kid experiencing this extreme level of distress and think, I can remove that stressor for them.
I can help them.
I can help them.
I can help them. And that's, I think, from a parent's perspective, is I am being helpful to my child by removing the stressor that is causing them so much distress. And can you kind of speak to that? That there are things that are helpful and there's things that are not helpful.
Yes. So I think parents are thinking, I'm going to help my child by removing this stressor. And then there's also like legal consequences for parents when their kid is experiencing so much school absenteeism that they start to get truancy letters. And then the parents' anxiety builds and gets worse. So then they look for this like kind of quick fix in that moment. But what happens, what we see, is that if we choose, I know there's tons of reasons that people do homeschool and online school, and there's other reasons that exist for that. And so I'm not just being critical of all those reasons. But when we do that for the reason of accommodating symptoms of depression and anxiety, what we see is the depression and anxiety gets so much worse. And it's so hard to see because the longer that goes on, the more those symptoms have built up. And it's extremely hard to treat. It's really hard to treat.
I hear it all the time. It's like, how can I be helpful to my kid who's experiencing mental health problems?
So thinking about it from the perspective of how do I support my kid through these symptoms versus supporting them to avoid the stressor. So what can be helpful is being their cheerleader, telling them, I'm here for you. I'm going to do this with you. I tell parents all the time, like, be the cheerleader, not the fixer. Getting them treatment is really the best thing that you can do in this scenario. And that may require a period of removal from the stressor, right?
Yes.
And I think that that's very helpful when we're working on the symptoms. But it's not helpful if we're saying, we're going to enroll in online school. We're not going to do any treatment. I think this will just get better on its own after a period of time. Newsflash, it does not get better.
No, it gets worse.
It gets worse. It gets so much worse because now you've taken your child out of any social interaction, any structure. Anxiety, it builds. It builds the more time that we give ourselves to ruminate. What may start out as a little pea-sized fear becomes a giant fear. So getting back into the world after a period away, that's not easier. It's not easier at all. It's so much harder.
Yeah. Well, when your world gets smaller and smaller and smaller, and this is what we see a lot with people with anxiety is I fear airplanes, so I don't get on airplanes. I avoid it. And then that anxiety doesn't get any better by avoiding it. It only gets better through what we would call exposure, right? And not just to say, hey, we're just going to throw you on airplanes. Get treatment, right? Receive help. And so you have strategies to cope with the stressors instead of learning to avoid things. Because guess what? Okay, you're afraid of airplanes. That's fine. Okay, maybe you can avoid airplanes. Well, I have social anxiety. So now I'm going to avoid the world. I'm going to avoid social interaction. So that means I'm isolated and I continue to avoid. And then my world becomes so small that anything now causes distress. Anything outside the norm. And what we know about life is things happen that are stressful, that are anxiety producing. That's normal. And so we have to learn how to cope with the distress instead of just learning to avoid it. I think the common misconception is I am being helpful by removing the stressor, right? Like school. Because guess what? It does get better at first. It does. And so what we
both do in our work, sometimes it makes things worse at first and then better in the long term. Can you speak to that it might get worse first?
Yes, and it probably will, to be honest, because like you said,
Agreed.
if the family and the support system has been intervening by accommodating the symptoms, they have now kind of taken responsibility for removing the stressor every time the person feels distress. And usually what happens is after that cycle goes on for a little while, that becomes very burdensome to the support person. And they end up calling us, like you said, after that little honeymoon period where it seems a little bit better, it gets real bad. And that's when they tend to call us. And usually, especially when they call our level of care, they're kind of in a crisis here. Like, oh my gosh, I've kind of created this system where this person is so reliant on me to accommodate them now. And I can't do that all the time. And they're not functioning. And what do I do now? And unfortunately, it's a lot harder to treat at that point, but it's very possible to treat it. I think it's just very important that the person who's accommodating the symptoms comes into the treatment knowing that they can't do that anymore. We have to remove that. And that's going to cause a lot of distress. They're going to be real mad at you, and they're going to be real mad at me until we kind of create our new homeostasis, our new norm of how we interact with each other. And it's going to challenge them because they're going to have to take responsibility for coping with this distress back on themselves. And that's going to be really hard. And again, if you're working with you, an outpatient, or us in PHP or IOP, there's a lot of therapists around, and we are going to support them through it, and we're going to teach them so many skills to help them get through it. I need you to be very, very mindful to not accommodate as we go through this process, because it'll prolong the process, right?
And that's how somebody could support their loved one going through some sort of treatment or therapy, is not continuing to tiptoe around them, walk on eggshells around them. And I hear this a lot, not just in parent-child relationships, but in friendships and in marriages and in those relationships, that a person learns to avoid certain things in their relationship because it upsets them. And so when we're working with somebody on anxiety, depression, whatever it is, they're working within a system in which they've taught everyone around them, no, don't go near that. Don't touch that. Don't anger me. Don't cause me distress. Or else I'm going to blank, right? I'm going to melt down. I'm going to get angry. I'm going to yell. I'm going to shut down, whatever it is. And so, yes, we are treating this person, but we're also probably going to be encouraging their whole system to not accommodate for them anymore. And that's going to suck. That sucks so bad. For everybody involved.
It's hard, but it's the work that we need to do if we're going to truly change this dynamic and help this person learn to handle these symptoms in a different way. So I think it's really important as part of like the pre-treatment process to call that out. Say, this is the dynamic we need to work on. Are you guys on board with that? And if you're not, that's okay. Maybe the goal needs to be different.
So ultimately, it's not about school. It's not about any kind of outcome. It's about how do we support them in the long term to not continue to avoid anything that causes distress. So how would a parent know that they are being helpful to their child or that they are enabling their child?
I think asking yourself the question and truly being introspective about the ways that you're supporting them, and if those interventions are removing the stressor and ways that you are potentially accommodating the symptom versus pushing them and challenging them to work through it and supporting them as they do. So is the way I'm responding challenging them to work through this, or is the way I'm responding helping alleviate some stress for a temporary period of time? Because accommodating the symptoms is very temporary, like you said. Like if we see it get better, it's usually very short-lived, and then another stressor happens and we respond in the same way, and we're in a cycle. So that's another question you could ask yourself: is this a cycle? Is what I'm doing is what I'm doing helping long term or future, or is this only helping for a brief period and then it comes right back? That's a good way to look at it too, I think.
Yeah, so somebody might know that they're enabling their child by the symptoms returning, or the symptoms returning in just maybe a little bit of a different way. Yeah. Okay, got it.
Yeah.
So if a parent is listening to this and they're like, oh my gosh, like I really want to be helpful to my child who is struggling, or even, I'm an adult and I want to help my friend who is struggling. How could they be helpful in being that cheerleader versus like, suck it up, I'm not going to accommodate for you anymore, and you just have to deal with it?
So I think this is where we kind of shift the topic to boundaries, which I know is a topic that you love.
I do love boundaries.
And healthy boundaries. And okay, if you're an adult, it's a little bit different topic than if you're a parent. But either way, boundaries are important, right? So if you're an adult who's supporting another adult, think about what your responsibility truly is in this dynamic. Are you taking responsibility for something that is not your responsibility? Are you feeling burdened by supporting this person? The codependence dynamic is really important to evaluate here. Like, am I taking responsibility for somebody else? If the answer is yes, you're probably accommodating the symptoms. If you're feeling burdened by it, you're probably accommodating the symptoms. Being a cheerleader and saying, hey, I love you and I will help you get help. I will take care of your dog or your cat if you need to go and seek a higher level of care for this.
I'm there for you. I'll listen to you. I care about what you are struggling with. Yeah.
I care about it, and I'm not fixing it. I'm not intervening in ways that fixes it for you.
Yeah.
But I'm here for you all day long.
Yeah.
While you work on this for yourself. That's support versus accommodating and enabling. I hear parents say often that it's really hard for them to find that fine line between enabling and love and support, because they are truly responsible for their kids in a lot of ways. And so that's a little harder, and I think maybe that's harder to generalize. It's hard for me to give just like a blanket answer for parents, because there's things that you have to do for your kid.
Yeah.
You can't just put them out. You can't just say like, I'm not going to
like suck it up,
take
kid.
care of you anymore. That's
fine. I'm not going to tiptoe around you anymore. I'm not going to help you anymore. I'm not going to take this away anymore. And like, that's not what we're pulling for. This lies on a spectrum, and it is a complex topic. This is why we always encourage people, like, get help.
Right. That's what I was thinking.
Get
like maybe
help.
My blanket answer is get a professional to talk through this with you.
Yeah. If parents want to be helpful and not accommodate, that they can listen and not fix.
Right.
And they can listen by using validation. What that might sound like is, it makes sense that you feel blank because blank. It makes sense that you feel anxious about going to school because there's a lot of unknowns at school. You have to get up early. It's uncomfortable to sit in those chairs all day. There are people that are mean to you at school. It makes sense that you're anxious. Right? Period. End of sentence, right? Oh my gosh. I support. And it might even be, how can I support you today? Well, I don't want to go to school. You have to go to school today. So how else can I support you? Can I pack you a nice like lunch that you can look forward to? Can you step outside today? Or whatever it needs to be so that you can continue to face the stressor until you can build those skills and get stronger.
Also listening to understand the underlying reasons for that anxiety and supporting with overcoming those fears and those worries that are probably valid. Like validating and understanding that can be really reassuring to kids to know that we're not just like blowing it off. I mean, the law is that you have to go to school. And I mean, that's a statement that we use. You do have to go to school. That is the law. But there's a lot of things we can do to support you with this very valid, real anxiety that you're having and be in school.
Yeah. So if we've just like kind of kept somebody company, right? They've had the little earbuds in and they're running errands today, and we have just been two friends sitting with them today. What is a takeaway that they can use in their relationships?
I think this again goes back to the topic of boundaries and healthy relationships. And being in relationship with someone, you still have your own independent sense of self and responsibility for yourself. Supporting someone and loving someone does not mean the same thing as taking ownership and responsibility for their life. So if you are hearing this and you are hearing things that are like, ding, 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 I might be doing that. You might consider, again, talking to a professional and getting some support on your own healthy boundaries for yourself and evaluating your individual relationship, because we've made some kind of generalized blanket statements, but everybody's situation is different and individualized, and that's where a professional can really help guide you to talk about your specific relationship and what might be accommodating a symptom versus being a support person.
Yeah, it's difficult to know. And so having some professional help would be amazing.
Right.
If you're identifying with this.
Definitely.
Yeah. So thank you so much for being here today. I really, really appreciate your time and your insights. I will put Embrace You's information in the show notes for today's episode. If you are loving this podcast, which I know that you are, give us a rating, 5 stars. You can subscribe on Apple Podcasts and Spotify. I should have this part down already. Apple Podcasts, Spotify, TikTok, Instagram, YouTube, we're everywhere. So find us and find Embrace You. You can like their page and follow them on Instagram as well. I really hope you have a good day. But if you don't, that's okay as well. I'm glad that we could keep you company, and we are off the clock.